The issue of returning to a mask mandate is back in the news tonight. Toronto's top doctor was asked during a Board of Health meeting today at what point the city would consider bringing back mask mandates, beginning with schools.
Certainly, we would be looking at things like the severity of illness and the impact on health care, to say nothing of the impact on individuals themselves. So I don't know that there is a specific threshold on any one particular indicator. It would be the entire, sort of the totality of what we see on the ground and the potential benefit that would be derived from having a very specific mask mandate.
And a top doctor at an Ottawa Children's Hospital is asking members of the community to wear masks indoors amid a surge in viral illnesses among kids.
And the overwhelming majority of those children are coming to care because they're having difficulties breathing or having fever or having challenges because of viral respiratory infections. I've never seen it like this before, and I'm really worried.
Dr. Lindy Sampson, Chief of Staff at CHEO, made the comments at an Ottawa Board of Health meeting today. She says the hospital is taking steps to address high patient volumes, but also asked residents to wear masks in crowded indoor spaces, including schools, to reduce viral spread. Health Minister Sylvia Jones commented on masks today after the health ministers' meeting concluded in Vancouver.
As we always have, and we will continue to do, we have very much relied on our medical experts, the Chief Medical Officer of Health, of course, in Ontario, Dr. Kieran Moore, and his expert advice. We will continue to do that. The input from Toronto Medical Officer of Health is important and part of that conversation, but in Ontario, of course, we have 34 public health units. So we'll continue to get that feedback and rely on experts like the Chief Medical Officer of Health in Ontario, Dr. Moore.
For more on the possible return to masking, we're joined live tonight by Pediatrician Dr. Dina Kulik. Dr. Kulik, great to see you. Thank you for joining us.
You're welcome.
So the trends, they're troubling. I'm sure you agree. Sick children with respiratory viruses are filling hospitals. Is it time to bring back masks in schools?
It's a tough question. So certainly sick kids are filling in hospitals, but also very much in clinics as well. Our volumes at Kikru, where I work, are very, very high. Many of our patients are sick, and not just with COVID, of course, but with other respiratory viruses. So influenza is quite high already, given that it's early November. We're seeing quite a lot of influenza, as well as RSV, which has been in the news so much recently. Very high numbers of respiratory viruses. And unfortunately, some kids are getting very sick, which is leading to hospitals becoming more filled with children that are sick from respiratory illnesses.
So would masks help? Masking in the classroom, in the hallways, in schools?
There's no doubt that masking does help prevent the spread of respiratory viruses. My kids are back in school. I have 4 children from age 5 to 12. They're all in masks. If they're going to be in school, I want the masks because I know that they're much more likely to get sick if they're exposed to other friends. And their classes have been filled with sick children since the beginning of school. Many days, my kids come home and say that half their class wasn't there, or many kids are coughing or sneezing in their classroom. Masks do prevent the spread of respiratory illnesses. Now, not every child can wear one. Many younger kids are not comfortable in them, of course, but by and large, most kids can wear a mask, and they can absolutely prevent the spread of respiratory illnesses.
So as a physician and as a mother, a parent, would you like to see a mandate, or do you think it's okay for parents, for families to make that individual decision at this time based on where we stand?
I am all about encouraging mask use. So mandates are challenging for families. There's quite a push and pull in terms of mandates, I find, since the pandemic started. I certainly encourage my patients to wear masks when they can, if there's no contraindications to do so, and they're older than 2, knowing that that can help keep them safe. In addition to staying home if you're sick, keeping clean hands, keeping distance from people that are sick. There are lots of things we can do to help prevent the spread, but no doubt about it, good mask wearing can prevent the spread of illnesses.
Yeah, you talked about the number of children who are sick with very serious infections like influenza, RSV. You talked about what you're seeing at your clinic, and also contributing to the problem is a countrywide shortage of children's Advil, Tylenol, and now amoxicillin. I'm sure that is not helping either.
No, it's certainly not. And we've had a shortage of these medicines for fever for a number of months now. And because so many kids are sick, so many parents are scrambling to find these medications to keep their kids comfortable, leading to ongoing shortages. And because so many kids are sick, in many cases, kids are being overprescribed antibiotics for their likely viral illnesses, they are subsequently using amoxicillin and other antibiotics when that is usually not necessary. Most of these illnesses do not require antibiotics. That's leading to further shortage of that, which is a trouble for the kids that really do need access to these antibiotics for true bacterial infections.
For sure. What is some advice you can give to parents who are worried about their little ones, who don't want their children to fall sick?
I think as a community, we have to come together and recognize that me as a person is part of a bigger community. If my kids are sick, they're staying home. And that's a challenge when you're a working parent. I absolutely understand that. But if we're all sending our kids sick, that's going to continue to spread viruses amongst our community. So, you know, at least if you're sending your kid, if they're not well, I do strongly recommend that they wear a mask at least to prevent their friends from getting sick. Again, keeping that distance, keeping clean hands. And of course, if your child's unwell, please touch base with their healthcare provider to find out if there's anything that they can do separate from the normal viral management strategies.
Okay, we'll leave it there. Pediatrician Dr. Dina Kulik, thanks so much for joining us this evening.
You're very welcome.
Meantime, the University of Waterloo is bringing back its mask mandate. So starting tomorrow, masks will be required for all indoor activities that are part of academic instruction. That includes lectures, seminars, labs, tests, exams, and all indoor classes. The school says students may also be asked to mask up when meeting with a TA or an instructor.